silent, deadly, invisible. That's how blocked arteries quietly threaten millions of lives every year. The danger. Your body often warns you, but the signs look like normal tiredness, aches, or shortness of breath we brush off. In today's video on Health 365 Day, I'm Dr. Mark Turner, and I'll reveal 10 critical warning signs your arteries may be dangerously blocked. Recognizing them early could mean the difference between prevention and a life-threatening emergency. Warning sign number 1. Chest discomfort, angina. The very first red flag is chest discomfort, medically known as angina. But don't be fooled by what you've seen in movies. It's rarely the dramatic scene of someone clutching their chest in agony. For most people, angina feels more like a pressure, tightness, squeezing, or even just a dull ache in the chest. Here's what's really happening. Your heart muscle is like an engine. It needs a constant flow of oxygen-rich blood to keep working. But when plaque builds up in your coronary arteries, it creates a bottleneck. During times when your heart needs extra oxygen, when you're climbing stairs or dealing with stress, it simply can't get enough. That's when you feel discomfort. But this discomfort doesn't always stay put in your chest. It can travel down your left arm, up to your neck and jaw, into your back, or even into your upper stomach. That's because your heart shares nerve pathways with other parts of your body, so the pain spreads like mixed up electrical signals. One dangerous thing about angina is its predictable pattern. It usually comes during activity or stress, then fades with rest. Because of that, people often brush it off as tiredness, indigestion, or muscle strain. But in reality, each episode is your heart crying out for oxygen. Research is crystal clear. Angina is often the very first sign of serious coronary artery disease, and ignoring it raises your risk of a heart attack dramatically. If you ever notice recurring chest pressure or tightness, especially if it happens with exertion, don't dismiss it. Seek medical attention immediately. Warning sign number 2. Shortness of breath. The second warning sign is unexplained shortness of breath. Now, I'm not talking about being winded after running up several flights of stairs. I'm talking about suddenly feeling out of breath during activities that never used to bother you, or even while you were at rest. Here's why this happens. When arteries get blocked, your heart struggles to pump blood effectively. Think of it like trying to water your garden with a hose that has a big kink in it. No matter how hard the pump pushes, not enough water gets through. In your body, that means your tissues don't receive enough oxygen. To make up for it, you start breathing harder and faster, as if your body is begging for more air. Mayo Clinic research shows that shortness of breath is often one of the earliest signs of heart failure, which itself often comes from years of blocked arteries damaging the heart muscle. As the heart weakens, it can't pump efficiently, and fluid begins to back up into the lungs. This symptom is especially important for women. Studies reveal that women are more likely to experience shortness of breath as their main sign of heart disease, rather than the classic chest pain men usually report. At first, it may only happen when you're climbing stairs. Then, maybe just walking across the room. Eventually, it can strike while you're doing something as simple as getting dressed. Each stage is your heart showing you it's losing its ability to keep up. That SY this ISNT, something to ignore it S, a warning that your body is running out of time. Warning sign number 3. Dizziness, lightheadedness, or sudden nausea. The third red flag is a troubling trio. Dizziness, lightheadedness, or sudden nausea. These can all mean that not enough oxygen-rich blood is reaching your brain. When arteries that supply your brain or heart are narrowed, blood flow becomes compromised. Your brain, being highly sensitive, reacts quickly when it doesn't get what it needs. The result, that spinning or faint feeling we call dizziness. UT Southwestern Medical Center research shows that these symptoms often appear together during heart problems, because they share the same root cause: reduced cardiac output from blocked arteries. In other words, your heart isn't pumping strongly enough to keep your blood pressure stable. Sudden nausea is another piece of the puzzle. Normally, your digestive system needs plenty of blood flow to function, but when the heart is in trouble, it diverts blood away from digestion to prioritize the brain and other vital organs. That's why some people feel sick to their stomach during cardiac distress. Most people brush these symptoms off as dehydration, stress, or maybe even a stomach bug. But when dizziness, lightheadedness, and nausea strike together, especially if you also feel chest discomfort or shortness of breath, it could mean your arteries are severely blocked and your body is on the edge of a cardiac event. Warning sign number 4. Unexplained sweating and fatigue. Next on the list is unexplained sweating, especially cold sweats, and persistent fatigue. Cold sweats aren't like the normal sweating you get after a workout or on a hot day. They come out of nowhere, leaving you clammy and uncomfortable. This happens because when your heart isn't pumping enough blood, your body goes into emergency mode. Stress hormones flood your system, triggering sudden sweating as your body tries to cope. And then there's fatigue, something I see far too often overlooked. This isn't the everyday tiredness that goes away after a good night's sleep. This is deep, unrelenting exhaustion that doesn't improve with rest. Here's why. When your arteries are blocked, your heart has to work overtime to push blood through. Over time, this constant strain wears it down. Your heart muscle itself becomes fatigued, and that exhaustion spreads throughout your body. Women especially need to take this symptom seriously. Studies show that women are more likely to report unexplained fatigue and sweating before a heart attack, while men more often experience the classic chest pain. Some women even describe feeling suddenly drained for days or weeks before a cardiac emergency. If you ever find yourself dealing with extreme tiredness that doesn't make sense, or breaking out in cold sweats without reason, your body could be warning you of blocked arteries. Warning sign number 5. Pain that spreads beyond the chest. Finally, let's talk about pain that spreads beyond the chest. When your heart doesn't get enough blood flow, the pain often radiates far beyond the chest. Because of shared nerve pathways, the discomfort can show up in your shoulders, arms, back, neck, jaw, teeth, or even your upper stomach. Research from the Mayo Clinic confirms these patterns. While left arm pain is the most recognized warning sign, the truth is, it can affect either or both arms. Some people feel a dull heaviness in their shoulders, while others notice aching in their back, especially between the shoulder blades. Jaw and neck pain are particularly tricky. People often think it's a dental problem or just muscle strain, but if that pain comes during exertion and eases with rest, it's much more likely to be cardiac. Even upper abdominal pain can be misleading. Many people mistake it for indigestion and reach for an antacid, when in reality, their arteries are blocked and their heart is in distress. The danger here is that people chase the wrong treatment. They see a dentist for jaw pain or a chiropractor for back pain, while the real problem, a blocked artery, keeps getting worse. Warning sign number 6. Leg pain or cramping while walking. One of the most overlooked signs of blocked arteries shows up not in your chest, but in your legs. If you ever feel cramping, aching, or heaviness in your calves, thighs, hips, or even buttocks while walking, then notice that it eases once you stop to rest. This could be a condition called peripheral artery disease, or PAD. PAD occurs when the arteries supplying your legs become narrowed by plaque buildup. At rest, your muscles may get just enough blood flow to stay comfortable. But as soon as you begin walking, your muscles demand more oxygen. And if your arteries can't deliver it, your legs protest with pain. Cleveland Clinic experts estimate that more than 200 million people worldwide live with PAD. And in the US alone, about 12 million adults over 40 are affected. What's especially alarming is that PAD rarely appears by itself. If you have blocked arteries in your legs, there's a strong chance you also have blockages in your heart or brain. The pattern of pain with PAD is very distinct. It happens consistently at the same walking distance and improves quickly with rest. Unfortunately, many people dismiss it as just getting older, poor fitness, or simple muscle strain. But true intermittent claudication, as doctors call it, is actually your legs screaming for more oxygen. The progression is also a warning. At first, the pain might only appear on longer walks. Later, it comes after shorter distances. Eventually, it can interfere with basic daily activities. Ignoring it means the underlying blockages just keep getting worse, not only in your legs, but throughout your arterial system. Warning sign number 7. Non-healing, foot or leg sores, coldness, or skin color changes. PAD can also progress to more visible warning signs, ones you can literally see on your skin. When blood flow to your legs and feet is severely compromised, your tissues don't get the oxygen and nutrients they need to heal or function normally. This leads to problems like non-healing sores or ulcers that linger for weeks or months, persistent coldness in your feet or lower legs, especially if one limb feels colder than the other, skin color changes, such as pale, bluish, or shiny skin. Sometimes you may even see mottled patches, showing uneven circulation. Research from the Cleveland Clinic confirms that when wounds on your feet or legs refuse to heal, it's a strong sign that blood supply is dangerously low. Similarly, temperature differences between limbs are important clues. If one leg feels noticeably colder than the other, it suggests that arterial blockages are much worse on that side. Another overlooked sign: hair loss on your legs and feet. Hair follicles need consistent blood flow to grow. Reduced circulation means the hair growth slows down or stops completely. These changes are your body's way of telling you the circulation in your lower limbs is failing. And if that's happening in your legs, chances are your heart and brain are also at risk. This isn't just a cosmetic issue, it's a life-threatening warning. Warning sign number 8. Erectile dysfunction in men. This next sign may surprise some people. Erectile dysfunction, or ED. For men, ED is often one of the earliest red flags of arterial blockages, sometimes showing up years before more classic cardiovascular symptoms appear. Here's why. Erections depend entirely on healthy blood flow to the arteries of the penis. These blood vessels are smaller than those supplying the heart or brain. That means they often get blocked earlier, long before larger arteries show severe narrowing. Research from the Physicians' Committee for Responsible Medicine highlights the strong connection between ED and cardiovascular disease. Men who develop erectile dysfunction without an obvious psychological cause face a significantly higher risk of heart attack, stroke, and peripheral artery disease later on. This makes ED one of the most valuable early detection tools we have. If plaque is clogging the arteries in the penis, chances are it's also building up in the arteries to your heart and brain. It's like the body's early warning system, giving you a chance to act before something more serious happens. Unfortunately, many men attribute ED to aging, stress, or performance anxiety. And while those factors can play a role, the vascular connection should never be ignored. If you read a man over 40 and dealing with ED that doesn't have an obvious explanation, it's time to get your cardiovascular health checked. Warning sign number 9. Transient ischemic attack, TIA, or stroke-like symptoms. Now, let's talk about your brain. When arteries supplying blood to your brain become blocked or severely narrowed, they can cause a transient ischemic attack, or TIA. A TIA is often called a mini-stroke because it produces stroke-like symptoms. But here's the difference. A TIA resolves on its own, usually within minutes to a few hours, and doesn't cause permanent damage. But don't let that fool you. A TIA is a loud, urgent warning that a major stroke could be around the corner. Here are the hallmark signs of a TIA. Sudden numbness or weakness in your face, arm, or leg, often just on one side of the body. Facial drooping, where one side of the face looks lopsided. Slurred or garbled speech, or difficulty understanding others. Sudden vision problems, like double vision or loss of vision in part of your field of view. Research from UT Southwestern Medical Center shows that about 1 in 3 people who experience a TIA will go on to have a major stroke later. That's why doctors treat TIAs as medical emergencies, even though the symptoms fade. The most common culprit is plaque buildup in the carotid arteries, those large vessels in your neck that carry blood to your brain. When a piece of plaque breaks off, it can temporarily block blood flow, producing the symptoms of a TIA. Vision problems are particularly alarming. Imagine part of your visual field going dark, as if a curtain suddenly dropped across it. Even if your sight returns, this isn't something to brush off. Every TIA is a red flashing light telling you that your brain's blood supply is in danger. Warning sign number 10. The 6 Ps of acute limb ischemia. The last warning sign we need to cover is perhaps the most urgent of all acute limb ischemia. This happens when an artery in your arm or leg becomes suddenly and completely blocked. Doctors use the 6 Ps to remember the symptoms. 1. Pain, severe, sudden, constant pain that feels like burning deep in the limb. 2. Pallor, the affected limb looks pale, white, or waxy compared to the other side. 3. Pulselessness, no pulse can be felt below the blockage. 4. Paresthesia, tingling, numbness, or pins and needles sensations. 5. Paralysis, weakness, or inability to move the limb. 6. Poikilothymia, the limb feels cold to the touch because it is not getting enough warm blood. This is a true medical emergency. Without blood flow, tissues begin to die within hours. Delayed treatment could mean permanent damage or even amputation of the affected limb. If you or someone you know ever experiences multiple Ps at once, there is no time to waste. Call emergency services immediately. This isn't something you can walk off or wait out. It's a race against the clock to save the limb, and possibly the person's life. Why recognition matters, let's be very clear. Blocked arteries don't develop overnight. It's a slow, gradual process. Over years, cholesterol, fat, calcium, and other substances build up along the arterial walls. Doctors call this process atherosclerosis. At first, you might not feel a thing, but silently, your blood vessels are narrowing like a pipe slowly filling with rust. Then one day, without warning, the consequences hit. A heart attack, a stroke, or sudden limb ischemia. That's why recognition is absolutely critical. If you spot these warning signs early, you have a chance to intervene before disaster strikes. The difference between someone who notices chest discomfort early and gets checked versus someone who ignores it until a heart attack hits, often the difference between life and death. Why symptoms overlap. Another important point is that these symptoms rarely happen in isolation. Your cardiovascular system is interconnected. Blockages in your leg arteries pad often signal hidden blockages in your heart or brain. Erectile dysfunction in men can point to widespread vascular disease. A tiredness just warn of stroke risk. It tells you your whole circulatory system may be compromised. Think of your arteries as one network of highways. If traffic is jammed in one area, chances are there's congestion elsewhere too. Taking action. So, what can you do if you recognize one or more of these warning signs in yourself or in a loved one? Here's a step-by-step approach. Step 1. Don't ignore it. The biggest mistake people make is brushing off symptoms. I'm just getting older. It's probably indigestion. Maybe I'm out of shape. These excuses delay critical care. Remember, your body doesn't send signals without reason. Step 2. Seek medical evaluation. If you notice recurring chest discomfort, unexplained shortness of breath, leg cramps with walking, or any of the symptoms we discussed, schedule a checkup with your doctor right away. And if the symptoms are severe or